According to Shelter, at least 354,000 people were homeless in England over Christmas. This includes 161,500 children, rising 14% in 1 year. That's an increase of 44,500 people. And this includes people living in temporary accommodations, hostels, homeless shelters, and people living on the streets. And with the population being 57.6 million, that makes the homelessness rate 1 in 162. And it gets worse. In this article, posted on the 11th of December 2024, it was estimated that 3,900 people were living rough on the streets at any given time, a 27% increase in a year. Since then, an article posted just over 2 months later, on the 27th of February 2025, estimated 4,667 people sleeping rough on the streets, a stark increase of 767, or 19.6667%. Homelessness affects everyone in many different ways. It affects those who are homeless through infections and mental health problems caused by being on the streets, and a higher risk of infectious diseases outbreaks due to lack of sanitation and healthcare access. It leads to danger through higher rates of petty crimes, theft, and drug-related offences, as homeless people without jobs struggle to get by, so they do whatever they can to make money. But the bottom line is, homelessness is bad, and it's rising, and I want to find out why. So in this video, we'll be exploring the reasons behind homelessness and how people can fight against it, including opinions from those going through homelessness themselves. I created this channel with the purpose of shining a light on those with less, or those who are overlooked in society. From the homeless, to the drug addicts, to thieves and criminals. Everyone has a story, and everyone is human. This channel seeks to steer people away from the dangerous paths taken by some, and aims to help those who are on those paths voice their mistakes, ambitions, and methods of getting away from the life they lead. Please like, share, and subscribe to spread the message. So we'll start off with some historical statistics. This statistograph shows the number of main homeless duty households in England from 1988/99 to 2023/24. And these are described as legally homeless households that local authorities must assist under the Housing Act 1996. So this doesn't include rough sleepers, hidden homeless, and those in unsuitable or overcrowded housing. And on this graph we can see from the late 90s to the early 2000s the homelessness rate was sky high, and this was because of a lack of affordable housing, rise in private rental costs, and cuts to welfare support. Also, high levels of unemployment and low wages left many unable to afford stable housing. We see the numbers plummet after 2002, and this was due to the Homelessness Act of 2002, which placed a duty on local councils to prevent homelessness. Also, investment in social housing and support programs helped reduce rates significantly by the mid-2000s. From then, homelessness rates declined consistently before rising in the 2010s. It rose around this period for many reasons. Government cuts to benefits like universal credit, the bedroom tax, and the benefit cap left many unable to pay rent. At the same time, there weren't enough affordable houses being built, and private rents kept rising while wages stayed flat. Local councils faced huge funding cuts, reducing support for mental health, addiction, and housing services. On top of that, landlords could evict tenants without a reason under Section 21, making no-fault evictions a major cause of homelessness. The Homelessness Reduction Act 2017, implemented in April 2018, required councils to prevent homelessness through early intervention. This led to the lowest numbers seen on this graph in 2018/19. Since that drop, the rates have been rising, now at a level that we haven't seen since 2007. The rapid rise is a negative sign for the future, and looking at the main contributing factors, it's easy to see why the levels are rising. And the first factor I'll include in this is economic factors, namely the housing market, employment and wages, inflation, and COVID-19. The UK's housing market is a major reason why homelessness is rising, and here's how. Firstly, rent is increasing fast. Private rents have shot up faster than wages. People on low incomes are spending over a third, or even half of what they earn just to keep a roof over their heads. When rent becomes unaffordable, eviction and homelessness follow. ONS says that average rents increased to £1,369 in England in the 12 months to December 2024. That's a 9.2% increase. The national minimum wage, however, has increased by 6.7% for those 21 and over. This means the wage is increasing at a slower rate than housing, making it harder for individuals to afford places to rent. When it comes to employment and wages, today many jobs aren't stable. 0-hour contracts, gig work, part-time shifts, they don't guarantee enough to cover rent. Meanwhile, the cost of living keeps on rising, but wages haven't kept pace. Even full-time workers are struggling to stay afloat. In-work poverty is growing. People are working but still can't make ends meet. And one setback, like illnesses or job loss, can be all it takes to lose their home. Inflation is another key factor. As inflation rises, the cost of necessities like food, water, and temporary shelter also increases, hitting the most vulnerable the hardest. For those experiencing homelessness, even the little money they manage to earn or receive holds less value, forcing them to spend more just to survive. This makes it even harder to save for long-term solutions like renting or buying a home, trapping them in a cycle that's incredibly difficult to escape. This macro trends graph has shown an increase in the inflation rate since 2019, and this would show a correlation between the inflation rate and the rise in homelessness rates. And finally, COVID-19 was a big factor in the increase of homelessness in England. Hundreds of thousands lost their jobs or saw their hours reduced. Even with temporary protections, rent debt piled up, and when those protections ended, evictions skyrocketed. Centre for Cities recorded that 1.3 million people lost their jobs as a result of coronavirus in the UK from March 2020 to January 2021, a number which contributed to the meteoric rise, as a large portion of these job losses would have been in England. Next, we have policy and systemic changes, namely governmental and social services policies. The first government policy we'll look at is universal credit. And universal credit is a payment for people under state pension age and on a low income or out of work. It includes support for the cost of housing, children and childcare, and financial support for people with disabilities, carers, and people too ill to work. When someone applies for universal credit, there's a mandatory 5-week delay before the first full payment. And many people, especially those already on the edge financially, fall into rent arrears during this wait. Some people never recover from that initial debt and are eventually evicted. Even with universal credit, payments don't often match real-world rent. And with private rent rising faster than universal credit payments, landlords are becoming increasingly reluctant to rent to tenants on universal credit, with some explicitly refusing universal credit claimants, seeing them as higher risk. Another governmental policy affecting homelessness is Section 21 notices, also known as no-fault eviction notices. And it's defined as a legal document that landlords use to end an assured short-hold tenancy without needing to provide a reason. And if you're served one of these, you have a notice period of at least 2 months to find another home. And this instability leaves thousands at risk of losing their homes, often with nowhere to go. 32,000 of these notices were served in 2024 alone. And this definitely contributed to the large and growing numbers of homeless people in England. In addition to these, government funding cuts to local councils, supported housing and mental health and addiction services are a factor aggravating the homeless rate. And then we have social services. Since 2019, gaps in social services have helped drive up homelessness in the UK. And here's how. Firstly, care leavers. A child in care is a child who is being cared for by a local authority for more than 24 hours. And under the Children Act 1989, a child is looked after by a local authority if he or she falls into one of the following categories. If they're provided with accommodation for a continuous period of more than 24 hours, if they're subject to a care order, or if they're subject to a placement order. And in England, a child is generally considered no longer in care when they turn 18, though they're still entitled to support until they're 21, and in some cases until they're 25. And these young care leavers do receive some assistance, such as financial and housing options. However, a lot of the time, it's just not enough. Studies show that care leavers face a significantly higher risk of homelessness than the general population. These statistics show that more than 4,000 young care leavers in England were facing homelessness by April 2024. That's a jump of 54% in 5 years. This means that the risk for homelessness for young care leavers is 15 times greater than the rise in homelessness among all young people in England. Young people leaving care often get little support when leaving, and without stable housing or guidance, many quickly become homeless. And similarly to this, there's a poor discharge planning in other areas, such as people leaving hospitals, prisons, and mental health units. Often they are discharged with no secure place to go. To put it into perspective, this is a graph showing the percentage of people released from prison going straight into homelessness. In 2022, 10.6% of prisoners were released straight into homelessness. And in 2022, around 46,000 people were released from prison. This would mean that around 4,600 people were released from prison straight into homelessness in 2022 alone. These factors, alongside the lack of education on how and where to get help for the homeless, leave many stranded in dire situations. This interview I did with Jack, a 26-year-old homeless man, demonstrates this.
I'm not ashamed to get help, but I just don't know where to get the help from. Do you know what I mean? I've never been used to I don't know, because I've always worked. I've never really gone down the system route.
The final factor affecting homelessness in England is societal and personal factors, mainly mental health and addiction, and family and social networks. Since 2019, mental health issues and addiction have been major drivers of homelessness in England. Let's break it down. Mental illness makes it harder to work, manage money, and maintain a tenancy. And reports say that the percentage of homeless people with mental health problems has risen from 45% in 2014 to 82% in the 2018 to 2021 period, with 45% saying they're self-medicating with drugs or alcohol to help them cope with their mental health. This makes it harder for those already homeless to make it out of their situation and find a home, keeping the numbers high. And for those with a home, mental health and addiction is just as damaging. 1 in 4 people will experience a mental health problem of some kind each year in England, and 1 in 6 people report experiencing a common mental health problem like anxiety and depression. Studies show that the number of workers aged 16 to 34 years old who report that their mental health limits the type or amount of work they can do has increased more than 4-fold over the past decade. And this, accompanied with trends showing that alcohol and substance abuse levels in England are rising, make it harder for those in these conditions to work and function daily to sustain a home, often being left unable to work and in turn unable to make enough money to pay for a home, inevitably leaving them homeless. The increase in mental health problems and addiction has created a surge in demand for support. However, the supply of support has not increased enough to meet the ever-growing demand, and many people face both mental health struggles and addiction, but most services treat them separately, leaving some people to fall through the cracks. Without joined-up care, early intervention, and real investment, mental health and addiction will continue to feed homelessness in England. Finally, we have family and social networks. Since 2019, it has been one of the leading drivers of homelessness in the UK. Every year, thousands of people lose their homes after being asked to leave by family or friends. It's the most common reason people approach councils for help. Arguments, overcrowding, financial stress, all can trigger a breakdown, and once those doors close, there's often nowhere else to go. Many don't go straight to the streets. They sofa surf, staying temporarily with different people, but this kind of informal support is fragile. Since the pandemic, more people have lost these lifelines due to rising costs, household strain, and health concerns. And this graph from gov.uk shows the percentage of homeless households or the prevention or relief for homelessness by the council. And this refers to the number of households that are deemed homeless or threatened with homelessness and are legally entitled to assistance from their local council, either to prevent homelessness or to provide immediate support after it occurs. The graph shows that family circumstances rank high on the list for those in need of prevention, and even higher on the list for those who are already homeless and need support. Homelessness in England is rising, and behind every statistic is a real person facing daily hardship. Families are living in temporary accommodation with no sense of stability. Children are missing school, falling behind and losing their childhoods. People with jobs are still sleeping in cars or shelters because their wages don't cover rent. The NHS is overwhelmed, treating more cases of untreated mental illness, addiction, and chronic health issues linked to life on the streets. This isn't just a housing problem. It's a growing crisis that reflects deep social inequality and leaves lasting scars on individuals and communities alike. Homelessness in England isn't just a human tragedy, it's an economic crisis. Every year, councils and government agencies spend billions trying to manage its consequences. It costs over £20,000 per person to support someone once they become homeless, compared to just £1,400 to prevent it. In 2022 to 2023 alone, local authorities spent more than £1.7 billion on temporary accommodation, often paying premium rates for emergency housing that doesn't solve the problem. At the same time, homelessness pushes people out of work, reducing tax contributions and wasting potential in a workforce that desperately needs rebuilding. All of this creates a cycle where the cost of inaction keeps rising, while the people most in need fall further through the cracks. Investing in housing, mental health, and early support doesn't just change lives, it saves money and restores dignity. Now that we've had a look at homelessness statistics and the causes, it's important to look at what can be done to prevent and reduce homelessness moving forward. Firstly, we need to build more genuinely affordable homes, especially social housing. And we need to make sure that affordable means affordable, based on real local incomes, not just market prices. The benefit system needs to change. That means ending the 5-week wait for universal credit and making sure housing support covers real rent costs. No one should fall into homelessness because the system can't keep up with rising rent. No one should lose their home without good reason. It's time to end Section 21 no-fault evictions and introduce stronger legal rights for renters. Longer tenancies and fairer rents would offer the stability that people need. We need to catch people before they fall, and that means funding family mediation, supporting schools and GPs to spot warning signs, and stepping in early when someone's at risk. Many people lose their homes while struggling with mental health illness or addiction. With better funding for community-based care and support after treatment, we can break the cycle that leads from illness to the streets. Young people leaving care, survivors of domestic abuse, and people leaving prisons or hospitals, they all need safe housing, long-term support, and someone to guide them. Councils are on the front line, but after years of cuts, they need proper resources to prevent homelessness. Through outreach teams, emergency housing, and early intervention, and education that empowers people to prevent homelessness before it begins. Education that shows people who are struggling where to turn and that help is out there. And education for the wider community, reminding us all that people experiencing homelessness are human and anyone can become homeless. The homeless have feelings, the homeless have stories, and they deserve safety, dignity, and the chance to live a life that's happy, healthy, and full of hope. This is not just a housing issue, it's a human one.